Hi, you're listening to the Brain Health Network. The first article that we have to report today is in Neurology International, this month's issue of June 2018, titled Posterior Cortical Atrophy, a Rare Variant of Alzheimer's Disease. The study is from Dr. Meyer and Dr. Hudek from Guthrie Clinic in Sayre, Pennsylvania. Posterior cortical atrophy is a rare condition first described in 1988 involving progressive degeneration and atrophy of the occipital cortex, often recognized after an unexplained homonymous hemianopsia may be discovered. We report a case in association with Alzheimer's disease in a 77-year-old female who underwent single-photon emission computed tomography as well as PET scanning using fluorobetapir to evaluate progressive cognitive decline. This rare combination of findings and associated with dementia led to a detailed review of her imaging studies, as she had a surprising homonymous hemianopsia that developed over 1 year, period. This is finally identified as posterior cortical atrophy, a rare variant of Alzheimer's disease. The case report is described as follows. She had been followed closely by ophthalmology and was found to have a right-sided homonymous hemianopsia. This is found on ophthalmology plots, as shown here. This is a progression of change in her visual field starting from below, showing an incomplete hemianopsia that became gradually more and more dense as time went on, and to finally show the dense hemianoptic type pattern in the upper row. The next set of images show the CT at left with the MRI at right, demonstrating focal posterior cortical atrophy for the left visual cortex. Corresponding SPECT imaging of cerebral blood flow demonstrates an impairment of the left posterior parietal cortex, reflecting underlying Alzheimer's disease, but this extends to the medial visual cortex, reflecting a degenerative pattern. Finally, fluobetapir has been applied in an attempt to localize any type of amyloid plaque that may be focally in excess, but there was a fairly symmetric pattern identified. The final conclusion of the studies are as follows: that all cases of suspected Alzheimer's disease should be carefully screened by clinical and radiographic examination to exclude posterior cerebral atrophy, as this represents a risk to the patient with driving and other related activities requiring fully intact binocular vision. Although rare, posterior cortical atrophy is suspected at an increasingly more frequent rate, period.